Hello, welcome to On Either Side of a Beat. My name is Michael Damioli, and I am the clinical director at Colorado Medication Assisted Recovery, CMAR. And this is,
Cortland Mathers-Suter, the administrator of CMAR.
yes. And what are we here to talk about today, Cortland?
Well, I was hoping we could touch on Suboxone inductions. I
Hmm,
get this. I get this sense that there's maybe some confusion, maybe some dispellable myths, if you will,
sure.
that we could maybe just walk the watcher
It's
through.
definitely not a discussion that's had much in addiction treatment about what a Suboxone induction is. When by the induction we mean the process of getting started on Suboxone. Um,
Um, do you think that's because most programs are either kind of the more holistic counseling type programs or they're a doctor's office? Okay.
Yeah, I think that's exactly what it is. I think most programs don't do that.
Yeah.
I think, people getting started on Suboxone often through a doctor's office are just given a prescription for Suboxone and told how to start the medication, how to do the induction, and sent off to do it at home,
Right.
or it happens in a structured medical detox center.
Mhm.
But very often does it happen in an outpatient counseling center or even an outpatient medical practice. Um,
So I am a really busy addict.
mm,
I've gotten addicted to fentanyl. I'm smoking fentanyl every day, obviously. I my relationship with my wife is going downhill. I my kids are equally not around to see me kind of destroy myself, and in that state, I know I can't just go take 45 days of my life to heal because of the circumstances at home just aren't going to allow it. What does what benefit would what Suboxone offers differentiate itself from what just a straightforward medical detox with a residential rehab component?
Yeah, absolutely. That's a great question. I think the benefit of a Suboxone based recovery program is that it allows you to get back on the field, right? It allows you to get back into life, taking care of your family, work, responsibilities, things like that, almost immediately. The withdrawal phase is very short, um, and you are able to retain a level of functioning that you won't be able to have if you're an opiate user who decides to detox completely from opiates.
Yeah, that's a really great point. And you're talking about avoiding post-acute withdrawals
Sure.
symptoms in a lot of cases or syndrome.
Minimizing cravings.
Yeah, minimizing cravings.
And,
It's not an abusable drug
right.
like methadone would be.
And most importantly, you are very reducing your chance of an overdose. If there is a relapse, somebody who's on MAT or Suboxone is much less likely to have an overdose. So I think when we talk about Suboxone inductions, it's not many people realize that it's a bit of a process to get started on Suboxone. Most other medications that you start with, it's not a big deal, right? Your doctor gives you a prescription, you go home and you start taking the medication, and that's fine.
Right.
Suboxone, it's not difficult, but there is a bit more of a process, and that involves the individual before they start on Suboxone needs to be in moderate to severe withdrawals.
So what is that? Okay, so I'm calling CMAR on a Monday.
Mm-hmm.
Um, I want to get this stuff out of my system, but I cannot leave my home again to just leave life for a while
Sure.
and come back, hoping that things won't just have gotten equally, as stressful as they could possibly be. So, call on Monday. Where am I at on Tuesday? Is that the day that I'm taking off to start the detoxification?
It's very possible. It depends on how much you're using, how
Okay.
often, how long you've been using for, as well as I think the kind of the support system that's around you.
So if you have somebody there that can kind of provide you with the support and a little bit of monitoring,
Sure.
then
It's very possible that we could do a Suboxone induction on Tuesday, if not certainly by Wednesday at the latest.
and you're going to give me comfort meds, right? I'm not just going to be hanging out alone with. is just having the sweats, not sleeping, right?
Absolutely. We would give you some comfort medications to help manage some of the symptoms of your withdrawal.
Awesome.
Granted, there will be a level of discomfort
Yeah.
that comes with withdrawing from opiates,
Yeah.
but it will certainly be doable and manageable.